The information on HealthMD is for general discussion only. In no way is it a substitute for medical advice. Please consult your physician for any specific concerns you may have. HealthMD is brought to you by Ross University School of Medicine, a leader in medical education. Welcome to HealthMD, where you get the latest on cutting-edge medicine, including clinical visits. Today, we join Dr. Kamyab as he takes his surgery rounds in a Detroit hospital.
So we got called to the ICU to see a patient that's oozing from one of her incisions. She had a thrombus or a blood clot in her arm, so they went in yesterday and they took out the clot. They put her on blood thinners, but since then she's been oozing quite a bit, so it's been a fine balance between keeping her blood thin, but not too thin, so that she keeps bleeding out on us. Right? So I was just saying, I was here last night too, taking care of her. She probably remembers me. We were here pretty much all night at the hour, checking the pulses and the signals and everything. I changed her wrapping. It was oozing actually a lot more yesterday. I know the nurse just called me today because it was oozing some. So basically what we did, we turned off the blood thinners, for about an hour or two, then we restarted at a lower rate. And looks like throughout the day, it hasn't been too bad. Now, Shelly just called me that it was oozing a little bit through the dressings, which is not too bad right now, actually. I thought it was going to be a lot more. A little oozing is expected. I'm sure Dr. Opat told you this morning that you're going to have a little bit of oozing. Okay. So as long as your signals are okay and that your hand feels okay and you can still move it and everything, then we're just going to keep watching it.
Just don't move it.
You can move it a little bit, yeah, but as long as you're able to move it. Yeah, as long as you have signals and you're able to move your hand and feel your hand, then we're okay. Now, if it keeps oozing throughout the night, then we'll kind of go from there. We might have to rechange the dressings and again play around with your blood thinners a little bit. But for right now, I think we're okay. Just kind of watch it for now. Okay. I'm going to come back and see you overnight, just like I did last night, and keep a close eye on you. Okay? Any questions right now?
So when will you? When will you change the dressing?
Well, right now it's not too bad. Anytime you change the dressings, and you kind of take away the compression that this A-strap is giving you. So if it's not, yeah, it's got a little bit of elastic, so it's got a little pressure on it. But as long as it's not too bad, then we can just kind of watch it.
Based on her vital signs that you've seen so far, things are looking pretty good.
Things so far so good. Yeah, we're sort of staying the course. Her vitals are okay. Her pressure is a little bit low. I hear that's, they just gave her a little bit of morphine and things like that, which is known to, drop the pressure a little bit. It's not too bad. Her lab work has been okay. Her blood count has been okay, so she hasn't bled too much to the point where we need to transfuse or anything like that. And her signals are okay. So right now we're just staying the course. So this is a very pleasant female patient who presented to the hospital with a cold right arm. So whenever we say a cold arm, it usually implies that there's no blood flow going into that extremity. In this particular case, this was because the patient had stage 4 lung cancer. In other words, lung cancer that had metastasized. Because of this, she was found to have a hypercoagulable state, which means she was very prone to developing blood clots. And it was presumed that this state that she has caused her to throw a clot in her right arm. So this patient went into this OR. They essentially went right into the brachial artery as well as the radial artery, and they cleaned out the clot that was causing her cold right arm. So then this patient was subsequently sent to the ICU for close monitoring and left on blood thinners called heparin to control this hypercoagulable state that she has. Now, because of this blood thinner, this patient ended up having a little bit of bleeding or oozing from her incision. All right, do you need anything right now? Pain is getting better? No? You get some pain? Okay. Unfortunately, we have to keep checking your pulses every hour. So, probably won't get too much rest tonight, but it's something we have to do to make sure it stays nice and open. So this is a gentleman that presented to the hospital yesterday with a complaint of very painful and tender right foot. Now, this gentleman has diabetes mellitus, which, as we know, makes patients very prone to developing foot ulcers.
Hey, Mr. Moore. Hey, Dr. Reddy here from the vascular team. How you doing?
Okay.
All right, good. You're here with Dr. Rashid. Is that your regular doctor?
No,
No? Who's your regular doctor?
I go to
VA.
VA hospital.
VA. Okay, all right. Well, anyway, you're under Dr. Rashid's care here. They called us to come check on your foot.
Was he the one that cleaned my
No, that's the podiatry guys. Yeah.
doctor?
How long has it had the ulcer there?
About 3 weeks.
About 3 weeks?
About 2 weeks or yeah.
Okay.
3 weeks or so.
Now, you had one there before, right?
I did, but it had gotten way out and so forth. I I had it about 5 or 6 or 7 or 8 or 9 or 10 years ago.
A while ago. You got better. Wow.
Yes.
Came back.
Yes.
I gotcha. Okay. Any pain down there?
Ooh, Lord, yes.
So it hurts. Okay.
Hurts like hell.
Any fevers and chills?
Yes.
If you're diabetic, right?
Yes.
High blood pressure?
Yeah, yes.
Any other medical problems we need to know about? Appendix, tonsils, gallbladder?
No.
Still got all those.
Yeah.
Any neck artery cleanouts? Heart bypass?
No.
No aneurysm surgery? No leg bypasses?
No.
Varicose vein surgery?
No.
Okay. Any other male surgeries? Hernias, things like that?
No.
Okay. All right. Allergies to medicines?
Allergies.
You allergic to any medicine?
None that I know of.
Perfect. Okay, good. And then anything else about your health I should know? All right.
Man,
That's it? That's enough, huh?
no, I don't know what else to tell you.
That's good. No, that's all. I just want to make sure. Why don't you lay back on your back for me?
Man, see,
Hold your breath for me. He's got the murmur all over, heart murmur. All right, lift up your feet for me. Let me get the blankets out. There we go. Okay, bring them out. Yep, straighten out. Straight.
In this particular case, it appears that the ulcer became infected. The foot was very red, it was very tender, and very warm to touch. Now, they consulted us from the vascular surgery standpoint to make sure that the blood flow to the foot was okay, because another cause for foot ulcers occasionally is the lack of blood supply to the foot. In this case, we were able to find some signals in the foot implying that there is some blood flow going into the foot. However, the signals weren't very strong, so this patient requires further investigation of his blood flow into the foot. We're therefore going to get an imaging study called a CT scan angiogram, a CTA. Essentially, this gives a nice mapping of his entire vascular system, starting from the abdomen and then extending down to the level of the feet. This will then show us if there's any problems with the blood flow going down to the lower extremities.
So you got the ulcer there on the foot. It doesn't look very good. The bone there is exposed, so usually by definition the bone is infected. You may have an aneurysm also. So in order to check both things out, I'm going to get a CAT scan, and then we'll go from there.
okay.
On that note, let's hear from Dr. Jaiswal in Better Believe It.
The longest operation reported lasted for 96 hours and was performed in Chicago, Illinois on February 4th to February 8th, 1951. An ovarian cyst was removed from Gertrude Levanovsky by Dr. M.S. Roberts. Over a period of 10 years, Gertrude had increased in weight to 616 pounds and reached 9 feet in circumference. During the 4-day surgery, her weight fell from 616 to 308 pounds. Better believe it.
So this is a patient that came in last week on Friday night. He had a gunshot wound to the left clavicle, and then bullet fragments went inside his chest. Hey, how you doing? Do you remember me? From the first night you came in?
Mm-hmm.
Yeah, last Friday night? How did it go this morning for you? Or this afternoon, I should say, with the procedure?
Okay.
Pain? Okay. All in your left chest? All right. Anything else bothering you right now?
I'm feeling something right here.
Right there. Okay. Okay. Are you having any problems breathing? Not really?
Little breath.
A little short of breath? You Your x-ray looks pretty good. Okay, there's nothing really too impressive on the x-ray. Your lungs are nice and expanding. There isn't too much fluid in there, okay?
Y'all sucked it out.
Yep, yeah, they cleaned you out. They put another chest tube in.
A chest tube is used to remove fluid from the space between the lungs and the wall of the chest. The tube is placed between the ribs and between the inner and outer lining of the lungs.
We'll work on your pain. Let me just listen to your lungs here real quick. Take some deep breath for me, okay? Deep breath.
Deep as I can.
Good. Okay, good. Let me just take a quick peek at your dressings here. Okay, I'm not going to change your dressings because you just had surgery, but I just want to make sure they're nice and dry and that they're in place, which they are. Okay, so I'll let that be. Now let me just take a peek at your chest tubes. Now you have two here connected to one. Okay, because it looks like that one you had at first wasn't really draining all the blood you had in there.
So now I have another one.
Now you have another one. It's going to help you get better. It's going to help you get better faster to drain all that fluid you have in there. Okay? And there isn't much coming out of your tube, which is good. And if everything looks okay in a day or two, they'll probably take one out. And if everything still does okay, they'll take the other one out in a few days. Okay? Yeah, we can see what you have for pain and we can tweak your pain medications around. Yeah, and then we'll get another chest x-ray tomorrow morning, and then we'll repeat your labs again in the morning, and we'll go from there, okay? But we'll work on your pain medications, make sure you're comfortable. Any questions?
A lot of pain.
A lot of pain, yeah, I mean, that's somewhat expected for the type of surgery you had. You know, the lungs and the lung spaces are very, very painful, so when they do a procedure like this, and when they put another chest tube in, you know, it causes a lot of pain. Now, he's only a few hours, you know, from his surgery, so this is going to be the worst time right here. It's only going to get better, you know, from here on. But we can definitely work on his pain medications.
Will that bullet stay? Since it's so close
Yeah.
to the vertebrae?
Yeah, no, that stays. Yeah, we usually leave the bullet in. It causes more damage to go take it out than to let it be, yeah. So, I mean, we rarely ever take out a bullet.
For real?
Yeah, I know you see on TV a lot of times, they go fishing for the bullet, but most of the time, you cause more damage going in, so we just let it be. So right away, we got a stat x-ray, followed ATLS protocol. We noted there's a large, likely hemothorax or blood in his chest. So right away last week, we put a chest tube in his left chest. It drained out about 600-700 cc's of blood right away, which didn't warrant surgical intervention at the time. So we brought him to the ICU. We've been watching him since then. Now since then, we've been getting daily x-rays, and we noticed that he's been getting this, you know, this fluid accumulation and hasn't really been doing too well from that left side. So today he went and he got a thoracoscopy, which means putting a camera inside the chest to look in there and see what's going on. It looks like he had a lot of fluid and sort of stagnant blood in there. So they cleaned him out pretty good inside the OR, and they put another chest tube in. And so that's where we are right now. So the plan right now is to just keep, you know, getting chest x-rays every day, make sure the lung stays nice and clean, there's not much fluid accumulating. And then if everything goes well in a few days, maybe take one chest tube out, and then keep following in, and then again in another few days, maybe taking the other chest tube out. So his vitals right now are okay, his labs are all okay, his chest x-ray is okay. So we'll just work on his pain control right now, and then keep an eye on the chest tube output for the time being, and then we'll go from there. So we'll stay the course. We'll keep him in the ICU, check his x-ray in the morning, check labs in the morning, control his pain medications, keep the chest tubes in for now at least, and then take it day by day.
We appreciate you saving his life, actually.
Yeah. Well, that's what we're here for. So, yeah. Yeah, and you know, and it is painful putting a chest tube in, so I apologize for doing that, but it had to be done. It had to be done. So it had to be done.
Matt for you.
Real lucky.
We appreciate you
No
so
problem.
very much.
No problem.
So much.
Extremely lucky man.
Before we go for a short break, the resident report has an alarming heads up for our Desi community.
A new published analysis concludes that atherosclerotic peripheral arterial disease, PAD, afflicts over 20 million in India. Once PAD has progressed to critical limb ischemia, CLI, the risk of ulcerations, gangrene, limb loss, and mortality increase. Critical limb ischemia can also be caused by Buerger's disease, thromboangiitis obliterans, or TAO, a non-atherosclerotic occlusive inflammatory disease that most commonly affects the small and medium-sized arteries, veins, and nerves in the upper and lower extremities. Approximately 40% of patients who continue to smoke will require an amputation. Both PAD and CLI represent major and significantly underestimated problems for the Indian economy and healthcare system. Because diabetics represent 60 to 80% of CLI patients, India may unfortunately be on the path to becoming the critical limb ischemia capital of the world.
Welcome back to Health MD. Dr. Ajay Rao is in our studios discussing high blood pressure.
My name is Dr. Ajay Rao. I'm a practicing academic endocrinologist at the Brigham and Women's Hospital, which is affiliated with Harvard Medical School in Boston, Massachusetts. So hypertension, if you break down the word, actually hyper means high and tension refers to any sort of pressure. So hypertension refers to high blood pressure. The diagnosis of hypertension usually occurs in a primary care visit or an office visit to any doctors. You're usually have your blood pressure checked at your doctor's office, and at that time, if the numbers are elevated, you'll be told that you have high blood pressure or hypertension. That's the common way. Sometimes people may actually go to an emergency room because they have unrelated or related symptoms and find out that they have a high blood pressure. So we know from some large-scale studies that hypertension and its ramifications are really, really important from the standpoint of prevention of heart disease, from the prevention of stroke, and the prevention of kidney disease. So whenever you get a blood pressure reading, you get two numbers from that reading, and usually the top number is called the systolic blood pressure. The systolic blood pressure is the blood pressure in your blood vessels during a heartbeat. The second number, or sort of the typical bottom number that you get from a blood pressure reading, is called the diastolic blood pressure, and that refers to sort of the blood pressure in your vessels in between the heartbeats. Most of the time we have been focused on the top number, the systolic blood pressure, when we're diagnosing people with hypertension or high blood pressure. With day season hypertension, we've noticed that there's a rising incidence or prevalence of hypertension in the Desi population. We think this might be mostly related to the fact that we are finding that Desis are more overweight or obese, not only in India, but also in the United States. But there may be something specific about hypertension in Desis that we're still doing research about, including their diet, for instance. It's probably not just genetics, it's probably an interplay or relationship between genetics and your environment. So a lot of times, people actually don't have many symptoms at all when it comes to their high blood pressure or hypertension. They actually feel completely fine when the blood pressure is just a little bit over the normal limits. We do find that when people are at a very, very high ranges, they may feel like they're having headache, they may have a blurry vision, they may feel they're having a little bit of chest discomfort or chest tightness, and a lot of times this may require them to go to an emergency room or visit a doctor immediately. It is important to go see your doctor if your blood pressure or you feel like your blood pressure is elevated and you're having some of these symptoms such as a headache or chest pain or chest tightness. The reason for that is that having a high blood pressure that's really, really high could be very dangerous to you. And actually, before we had actually any sort of medicines for high blood pressure, a lot of people found out they had high blood pressure by actually having to go into a hospital and being admitted. The treatment options for high blood pressure are all pills that you take once or twice a day. There's a variety of classes or types of high blood pressure medications, and typically your doctor will choose a blood pressure medication based on where you're from, what sort of other things are going on with you. For instance, if you also have diabetes, and will make the appropriate selection based on all of those parameters. The big lifestyle changes that we recommend when somebody's diagnosed with hypertension is some sort of dietary modification or change in their diet and weight loss, sort of similar to what we probably recommend for people who have diabetes. Specifically in the South Asian community, we're still doing a lot of research on whether there is a relationship between salt and hypertension. Sort of the common recommendation is to reduce salt, and we do think that that is related to development of high blood pressure. But there is still a lot of research if that's actually the truth when it comes to South Asians. But currently the recommendation is definitely a reduction of salt intake. Well, hypertension really has many sort of complications that are related not only to the heart, but also to the kidney and your brain. From the standpoint of the heart, Having high blood pressure puts you at risk for having heart attacks, puts you at risk for having heart failure. From the standpoint of your brain, your mind, having a higher blood pressure puts you at risk for having strokes. And hypertension can also be a very common cause of kidney disease. So I think for the Desi population, the low-hanging fruit obviously are things such as dietary modification, weight loss, sort of watching what you eat. Everything in moderation is what we try to recommend, as well as keeping up to speed with your yearly visits with your doctor, keeping your blood pressure under control, making sure you've not developed diabetes, having your glucose checked every year. I think just aggressive surveillance for all of these risk factors.
Thank you for watching Health MD. Last but not least, Doctor's Joke of the Day.
This joke was sent in by Dr. Kapoor of Virginia. Man goes into surgery, and the doctor is really happy to see him. So right before the surgery is about to happen, the doctor gets down on both his knees and starts praying and chanting, inviting all blessings from all sorts of gods. And the patient goes, "Whoa, doc, what are you doing?" And the doctor says, "Oh, it's Desi custom to pray to the good Lord before beginning any new venture. And well, you're my first offering to the gods."
Health MD is a Pan Desi production.